Hi everyone. So today we will be discussing regarding diameters of fetal skull. So if we define what are the diameters of fetal skull, there are two types of diameters. One is the anterior posterior diameter, that is any diameter which is in the anterior posterior direction. So there are six anterior posterior diameters, and then we have transverse diameters. These are the transverse, four transverse diameters are there. So let's go through them one by one. Anterior posterior diameter. In a well flexed head means when our chin is touching our chest. So the head is said to be in a well flexed position inside the womb, inside the uterus. So in a well flexed head, the engaging anterior posterior diameter is suboccipitobregmatic. Now, what is suboccipitobregmatic? Any point from the nape of the neck, that is, if the position is like this, it is a well flexed head like this in the maternal pelvis. So this is the maternal pelvis and this is a well flexed head. So normally the position is left occipito anterior or left occipito lateral position. So this is the left side of the maternal pelvis and this is the occiput. So in a well flexed head, the fetal skull will go like this. So and the diameter would be suboccipit, that is from the nape of the neck to the center of the bregma. Any diameter which has bregmatic in its name, so it will be suboccipitobregmatic or submentobregmatic. It would be 9.5 centimeter. It is important. Both suboccipitobregmatic diameter and submentobregmatic diameter, they both are 9.5. Submentobregmatic is in fully extended head, that is fully extended head, face presentation. So in that case, the diameter would be submentobregmatic, that is a point from the area where our mentum is joining the neck. So a point from there to the center of the bregma, it would be submentobregmatic in face presentation. In vertex presentation, in fully flexed head, the diameter would be suboccipitobregmatic, that is from the nape of the neck to the center of the bregma. Both are 9.5. In case the head becomes slightly extended, it is not fully flexed, so it becomes slightly extended, so the diameter will keep on changing. Partially extended head or somewhat extended head can lead to occipito-posterior position. So in those, the diameter can be suboccipito-frontal diameter. So suboccipito means from the nape of the neck to the anterior point on the bregma. So it would be from the nape of the neck to the anterior point. It is not at the center of the bregma, it is to the anterior point of the bregma. This is 10 centimeters. This is suboccipitofrontal in slightly when the head is not fully flexed. If the extension increases further in occipito, then the diameter would be occipitofrontal, that is from the occipital protuberance to the glabella. So glabella is a point between the two orbital margins. So from the center, from the occipital protuberance till the glabella, this is 11.5 centimeters. This mainly occurs in occipito-posterior position where the head is partially extended. Further extension will lead to brow presentation. Brow means this portion will be the presenting part in the maternal pelvis. So in brow presentation, the diameter would be mento-vertical. What is mento-vertical? From the center of the chin. So from examine here is the chin. From the center of the chin to the highest point on the sagittal suture. So whatever is the highest point, from the mentum till the highest point on the sagittal suture is the mento-vertical diameter. It is 13.5 to 14 centimeter, and this is the largest diameter by which the fetus can present. But there is no mechanism of labor in brow presentation because none of the diameter in this maternal pelvis is 14 centimeter. The highest diameter in the maternal pelvis is 13 centimeter. Okay, so there is no mechanism of labor for a vaginal delivery in brow presentation where the diameter is mento-vertical. Thereafter, further extension. So in brow presentation, the face is partially extended. Further extension would lead to face presentation, where the diameter can be submento frontal diameter or submento brigmatic diameter. So submento frontal is from the point where the mentum is joining the neck to the tip of the frontal point of the bregma. So this is submento frontal. It is again 11.5, and submento brigmatic, as I already told, in fully flexed head in face presentation, it would be submento brigmatic. That is from the point where the chin is joining the neck, that is from the submental area to the center of the bregma. This is again 9.5. So two diameters are 9.5, suboccipito-brigmatic and submento-brigmatic. And the third diameter, which is important, is mento-vertical, which is in brow presentation, which is 14 centimeter. So these diameters are important AP diameters. Talking about the transverse diameters now. So there are 4 transverse diameters. Biparietal diameter, which is 9.5. So it is the diameter between two parietal eminences. This is imaginary line between the two parietal eminences is the biparietal diameter. When this diameter passes through the pelvic inlet, the head is said to be engaged. In primigravida, engagement occurs few weeks before the labor, but in multi it occurs along with the labor. So this is important. So this is biparietal diameter. Then we have bitemporal diameter. That is the diameter between the anterior inferior points on the temporal bone. So these are the temporal bones, and this is the bitemporal diameter. Then we have supra-subparietal diameter. That is a point above the one parietal eminence to the point below the other parietal eminence. This is supra-subparietal. Biparietal diameter is again 9.5. Then this bitemporal diameter is 8 centimeter, which is important. And then another diameter we have bimastoid, that is between the two mastoid processes. This is 7.5, and this diameter is not reducible. This is very, very important. So there are 4 transverse diameter and 6 anterior posterior diameter. I hope it was helpful. Thank you.